ever wondered if artificial intelligence could help healthcare providers predict which treatment will work best for someone with schizophrenia? Hi everyone, welcome back to my page. Today I'm discussing a fascinating study published by Amleshi et al. In 2024 titled Predictive Utility of Artificial Intelligence for Schizophrenia Treatment Outcomes, a systematic review and meta-analysis. Let's break down what this study is all about in simple terms. First, let's look at some quick definitions like schizophrenia. What is schizophrenia? Schizophrenia is a serious mental health condition that affects how people think, how they feel, how they behave. Symptoms and treatment responses can vary a lot from person to person. People with schizophrenia can experience positive symptoms, which are things added to their experience like hallucinations, seeing or hearing things that aren't there, delusions, strongly held false beliefs, and disorganized thinking or speech. They can also have negative symptoms, which are things taken away from their usual functioning, like reduced emotional expression, lack of motivation, social withdrawal, and difficulty experiencing pleasure. So what is artificial intelligence? AI. AI refers to computer programs that can learn from data and make predictions or decisions. A systematic review and meta-analysis is a type of research that looks at all the existing studies on a topic, combines their results, and tries to come up with the most reliable answer possible. Before we dive into the findings, it is important for us to recognize some of the real-world challenges in treating schizophrenia. The first, unpredictable treatment response. What works well for one person may not work well for another. It often takes weeks or months of trial and error to find the right medication or therapy. The second is side effects. Many antipsychotic medications can cause significant side effects, which sometimes lead people to stop taking these medications. The third is relapse and reoccurrence. Even with treatment, relapses are common and early warning signs can be hard to spot. The fourth is negative symptoms. These are especially tough to treat and can make it hard for people to engage in daily life or stick with treatment. The fifth is stigma and access to care. Social stigma and limited access to specialized mental health services can further complicate recovery. So what did Amleshi and colleagues do? They searched through thousands of studies and narrowed it down to 21 that used AI to predict how people with schizophrenia will respond to treatment. They looked at different types of data used in these AI models, such as clinical data, for example, the patient's history, the patient's symptoms, including both positive and negative symptoms. They look at demographics. They also look at EEG data, which are brainwave recordings. Imaging data, brain scans like MRI, multimodal data, which is a combination of all the above data. To measure how well these AI models could predict treatment success, these researchers used two important statistics: sensitivity and specificity. What is sensitivity? It is the ability of the AI model to correctly identify people who respond well to treatment. In other words, if someone is going to improve with a certain treatment, how often does AI get it right? Specificity, on the other hand, is the ability of the AI model to correctly identify people who will not respond to treatment. So if someone is unlikely to benefit from a treatment, how often does AI avoid giving a false positive? Why do sensitivity and specificity matter? High sensitivity means fewer patients who could benefit from a treatment are missed, while high specificity means fewer patients are given treatment that won't help them. In mental health care, this is particularly important because it means more people get the right treatment the first time and fewer people go through unnecessary or ineffective therapies. So what did the study find? Across all these studies, AI models had a sensitivity of 70% and a specificity of 76%. This means the models were fairly good at predicting who would and wouldn't respond to treatment. EEG-based models performed the best, with a sensitivity of 89% and a specificity of 94%. In other words, using brainwave data helped the AI make the most accurate predictions. Imaging-based models also did well, with a sensitivity of 76% and a specificity of 80%. Clinical data alone was less accurate, and surprisingly, combining multiple types of data didn't always improve predictions. However, Almeshi and colleagues also noted some challenges. There were differences in how each study defined treatment success, who was included, and what treatments were used. Some studies had small sample sizes, which means more research is needed to confirm these results. So why does this matter? If AI can help healthcare providers predict which treatment would work best for each person, whether they struggle more with positive symptoms like hallucinations or negative symptoms like social withdrawals, it could lead to a more personalized care, fewer relapses, and better lives for people with schizophrenia. It could also help providers avoid a frustrating cycle of trial and error, reduce side effects, and also improve overall patient outcomes. So now I want to share my personal thoughts about artificial intelligence in healthcare. AI is here to stay. It is already transforming the way we diagnose, treat, and even think about mental health conditions. While it is natural to have concerns about new technologies, I believe we have a real opportunity to learn how to use AI as a tool to enhance, not replace our clinical judgment and compassion. The key is to approach AI thoughtfully, understanding its strengths and recognizing its limitation, and always keeping the patient at the center of the care that we provide. As providers, we can choose to engage with these new tools, learn how they work, and help shape how they are used in practice. By doing so, we can ensure that AI supports us in making more informed, data-driven decisions while still honoring the human connection that is very vital in mental health care. Now, I would like to hear from you, especially if you're a psychiatric healthcare provider. Would you trust AI to help guide treatment decisions for your patients? What would make you feel confident using these AI tools? Please let me know your thoughts in the comments below. Thanks very much for watching, and please don't forget to subscribe for more updates on the latest in mental health research. I am Dr. Georgette Kui. Until next time, see you in the next video. Thank you.